Hi there, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. Right off the bat, we've got two great cannulas coming in the front of the shoulder. This is a part of the shoulder that we call the rotator interval. On the left side is the biceps tendon. On the right, we can see a tendon running up towards 11 o'clock on the screen. That's the subscapularis. And then running across the screen, kind of horizontally, that's the middle glenohumeral ligament. Now we're going to examine the shoulder in the same stepwise fashion that we usually do. And this is the biceps anchor. This is an area we've already shaved a little bit because there was some cartilage that was torn. But as we get down deep, we can see some of the tearing that was there. It's not the world's biggest slap lesion, but you can see how it's split back in here a little bit, and that's what was showing up on the MRI scan. So we're going to repair that. What's interesting is you've got this area in the glenoid where you've lost some cartilage right at the tip of the cannula. See this little dime-shaped, dime-sized area here? It looks like maybe from your fall or some other trauma that you sheared off a little bit of the cartilage. It's already healed with some fibral cartilage. That's a good example of what fibral cartilage kind of looks like. And I don't see any loose pieces yet, so we won't have to do anything to that, but it's interesting just to note. You can see how the rest of the glenoid is nice and smooth and white there. Here's the back of the shoulder. And as we look back here, the capsule looks fine. I don't see any signs of any damage to the humeral head. No signs of any instability. Your shoulder was not unstable. We come back up to the front. This is the rotator cuff at the top of the screen. And that looks fine as you come all the way back around. Okay. And then we'll come and look down the front of the shoulder. There's a good shot of that slap lesion. As we come down the front of the shoulder, we can see that the labrum's intact. No signs of what we call a Bankart injury, which is what people get when they have instability. And the inferior glenohumeral ligament down here looks pretty solid. So no signs of instability, just this cartilage, this condylar lesion that you had from before that you don't have to really do anything for because it's contained and already basically healed. And really the next thing for us to do is to stabilize this biceps anchor. Hold it carefully. So we're going to go ahead and take an instrument called a guide. We're going to place this down right in front of the biceps tendon here. Right about here. And then we're going to drill a hole into the bone. So you can just see there's a drill going down there. Okay. And now this anchor is just a punch anchor, meaning we don't have to screw it in. We just hit it with a mallet. And then once it's down, we unload the inserter. And that gives us two different colored sutures to work with, as you see there. We're going to pull back on the anchor just to seat it. So you can see how we pull back. And now that's solidly fixed in the bone. So the next step is to take out 3 of the sutures on the right side of the screen. We're going to take out both blues and the black suture just like that. Then we're going to take a switching stick and take these 3 sutures out of the way. And then we'll take our crochet hook and bring this black and white suture so it's inside the cannula. So now we're ready to make our first stitch. We use an instrument called a suture hook. We'll show you that in just. Okay, so we've got this anchor down. You can see the 2 sutures. And now this biceps is not going anywhere. It's anchored right back down to the bone, very solid. And we've shown you the rest of the shoulder. So I think we're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.